part of the human brain, the outer part is known as the cortex. Remember, cortex is always the outer part, just like the adrenal cortex, the cortex of the kidney, okay, renal cortex. Now, here, in the brain, interior of the cerebrum is composed mainly of white matter. Remember, the white matter is in the most interior part, and the outer part is the gray matter. That's a little bit reversed in the spinal cord. In the spinal cord, it's the white matter that's on the outside, and the gray matter that's on the inside. All right? So the functions of the cerebrum are the mental processes. Okay? Mental faculties, thinking. So when you're doing your calculations for the med math, you're using your cerebrum. Okay? Memory. Okay? So some people are blessed with a very good memory, and some with that, what is known as an eidetic memory, say that it's actually a curse because they don't forget anything. Yes.
I have a question. This might be a stupid question.
No.
But is there any correlation with the size of a woman's brain and a man's brain, or is it the same?
Okay. I'm not sure about that. I know there's a difference in muscular mass between a male and a female. So males usually will have bigger mass, muscle mass. But brain is nerve tissue. It's not muscle. So I don't know if there is or if there should be. I don't think so. Because I cannot say who are more intelligent, the male or the female, in general. You're gonna say female. No, what I mean is, men are probably better at some things than women.
Lying.
I mean,
Lying. They're not better because they always get caught.
Right?
but also women are more intelligent in. Why are the two guys so silent? Why don't you defend your gender?
Guys, we're good at reaching the top shelf and opening up those pickle jars, you know what I'm saying?
All right.
And guys are smarter because we're quiet right now.
Dr. Daniel Amen says that men's brains are 10% larger than females' brain, but bigger doesn't mean smarter.
Exactly.
It's just full of air.
That's a good question, and
So
that's.
they're bigger, but that doesn't mean nothing because they're really not smarter.
No.
Well,
all I said was guys are good.
You
for
know
reaching
why?
the top
You know
shelf
why
and
that
opening up the
is?
pickle
Because
jar.
it has been said.
Compared to me,
There's a book in the
Top shelf and pickle jar.
70s
Yes.
known as "I'm Okay, You're Okay." I don't know if there's still a copy of that book.
Okay.
According to this book, the average person or everybody actually is not using the 100% potential of our brains. Probably less than half is what we're using. So size really doesn't matter if you're not even using all of it, right? So it depends on how much percentage of the brain that we're using. That's why there's the concept of multiple intelligences. So some people have an intelligence on math. I know that math and music are correlated. That's what they say. Math and music, because they probably the centers for both are close to each other. And for example, if you stimulate the baby early with music, you are also stimulating the math center. So that's what they're saying. Now it's not 100% all the time, but there's a correlation for that. All right. So I don't know what the thing is. Even now we're going into mental health, right? Even now, some theorists are thinking that eventually all psychiatric or mental disorders, they will find a neurologic basis for that. Maybe a chemical basis for that or biochemical basis for that. So it's not just mental or functional problem. Eventually, they think that they can find an organic basis for all of these mental disorders, but so far, not true at this present time. And okay, there's this other question whether aging is a disease or not, but let's not go there. Okay, just think about it. If it's a disease, then you can possibly potentially cure it, right? Now, spinal cord, it says here, the interior is the gray matter, which is quite the opposite of the brain. So remember, it's still part of the central nervous system.
That's the part that does the thinking.
So all spinal cord reflexes, the primary center is the spinal cord. That is to make it a very quick reflex, because it will waste time if it has to go up to the brain, right? So the spinal cord is authorized to process and send the response on its own. All right. So this is actually this is spinal cord, and this is where they come out of the vertebrae. There's a hole in here. See,
First pause.
each segment has this hole. There's a hole in here and on each side, and this one is the right side. The right spinal cord at this level, spinal nerve will come out here, this hole, and the left one will come out on the opposite side. So you see they're coming out here, and then at the level of L1, number 1, it probably ends here, and what continues only is this thick fibrous tissue here, resembles the, so that's why it's called as the cauda equina.
That's like horse tail.
That's in Latin. In English it means what, Robert?
Cord of the horse? Tail? Oh,
Tail of the
horse.
equina horse.
It means what?
Tail of the horse.
Tail of the horse.
See?
What's that, Latin or something?
Here, this part.
Tail of the horse.
Yeah. It's not nervous tissue anymore, because the nervous tissue will end here at about L1. You see? If you look at your book, okay, it's more clear in your book. What page is that? I can see.
83.
183. You see it? The cauda equina.
Yeah.
See? So it ends here, right? That's the nerve tissue. Then it is just like, that's the cauda equina. Okay? So there's no, in the cauda equina, there's no nervous tissue there. Therefore, if you do a lumbar tap, it has to be after this. It has to be below this. Because if you do it higher, say in that thoracic area, you could hit the spinal cord. You don't want to do that. Spinal tap, lumbar tap, is only to obtain CSF, right? Cerebrospinal fluid, for sampling and for analysis. So, with this knowledge of the anatomy, the spinal tap should be lower than this point, right? So, to avoid injuring the spinal cord. So now let's go to the coverings or the membranes or the meninges. There are actually 3 meninges of the brain, of the central nervous system, and the spinal cord. And inflammation of the meninges is what is known as
Meningitis.
meningitis. Inflammation of the meninges. Usually it's an infection. Okay. So these 3 are the dura,
Matt.
arachnoid, and the pia mater. So I don't know why they put that in that order. The outermost is the dura, and then arachnoid,
Like spider.
and pia mater is the one that is
Where's the alma mater?
just like the visceral peritoneum. It's the one that's intimately attached to the nervous tissue, the brain or the spinal cord. So here, under the dura is known as the subdural space. It's just an empty space. And under the arachnoid is the subarachnoid space. There is no subpial space because right underneath the pia mater is is the nervous tissue itself. There is a space above the dura mater, which is known as the epidural space. So sometimes when there's a blow to the head, like in an accident or in a concussion, there could be either an epidural hemorrhage, so the bleeding is about the dura, or it could be a subdural hemorrhage, bleeding is underneath the dura, or it could be a subarachnoid hemorrhage, which is under the arachnoid. Okay, so that's why,
Which is pretty bad.
Subarachnoid.
I think the subarachnoid is closer to the brain. Where is the cerebrospinal fluid here? What space?
Inside the PMN. Oh,
One.
This.
2, and 3.
The which one? Cerebral spinal fluid?
The CSF.
Must
Where
be
is
one.
it? That is why when you do a spinal tap or a lumbar tap, that's where your needle should be, in that space, right? Because you want to obtain the CSF. So that question is important. It's right here. That's where the CSF is going to be. Subarachnoid space. Okay? So, also there's a central canal inside the cord. I'll show you a picture of that. Just like this. If this is one segment of spinal cord, there's a central canal inside. And it's filled up with fluid. And in the brain, there are known as ventricles, the open, empty space in the brain. No nervous tissue, that's occupied by the fluid, CSF. So, subarachnoid, central canal,
Oops. It's right there.
and the ventricles of the brain. All right, so these are where the CSF are going to be found.
There we go.
So see, this is the cross section of the spinal cord. Remember, the gray matter is inner than the white matter, which is outer. And this is the central canal. There's a hole. See this hole, and it goes all down to all the segments. That is the central canal. And what is inside the central canal?
The C.
No, this is already a spinal cord, right?
Oh. The cerebral spinal fluid.
Yeah, it's the fluid. Yeah, I just said that earlier.
CSF.
So remember, so this one is the spine. Is this anterior or posterior?
What do you mean? That surrounds it. Oh, that the spine part is posterior.
Posterior.
That's where the
So
projections are.
posterior. So here is the dorsal root, posterior root, and the anterior root is the other. The ventral or anterior root is that one. Towards the rounded part here is anterior. Remember, anterior and the spine is at the back. Posterior. Posterior or dorsal. Okay. Anterior or ventral. It depends on your position. If you're erect, then anterior posterior. But if you're like before animals were crawling on four, walking on four legs, so that's the dorsal and the ventral part, right? What else? And the ganglia, sympathetic ganglia, arachnoid matter. Underneath that is also the CSF. Now the peripheral nervous system, okay, cranial nerves, we said are 12 pairs, spinal nerves are 31 pairs, and dermatome is that segment of your skin that is innervated by a single cranial nerve or spinal nerve. So depending on where your pain is, right? Depending on where your pain is, the doctor can actually localize which spinal nerve or cranial nerve is affected because it's specific. So let's say this part here, it corresponds to a single cranial nerve or spinal nerve. Now, what condition that will affect, let's say, a single spinal nerve or that goes to a dermatome?
Osteoporosis.
What infection, viral infection that will
meningitis.
lead to vesicular lesions following that?
Shingles?
Yeah.
Zoster.
And the organism is what? What virus?
Varicella.
Herpes zoster, right? Okay, that's shingles. Okay, what gave you the clue was the vesicular, right? So that's why it's very painful because it follows the track of the nerve, right?
The red line is.
So, I would require you to memorize these nerves
You will?
I will require you
or for
to-
the test?
forever.
It's a long time, Mr. Javette.
Like,
I gave you the Spider-Man packet, right?
Yeah.
Okay, at the last page, there's that mnemonics there for.
You gotta do it with the video.
Uh,
To touch and feel.
okay, that's the one. And
How did it go?
I will also require you
I don't
to
remember it offhand.
remember or memorize whether they're sensory, motor, or both. Remember that some say Mary Money, but my brother says big.
You can tell by the name of it
Motor,
which one is.
So there are 12 of them, because you know why they like to ask that in the that's why it's in the Spider-Man packet. Okay, it's a core thing that they're gonna ask. So this is just study this drawing. It will show you the distribution of these nerves. The trigeminal nerve, nerve 5, for example, it's both. Some say Mary Money, but so it's both sensory and motor, right? So see the distribution, 3 main branches like that. See, and it's
Chicken
also
foot.
known. The distribution is known as pes. I think I told you this before. And Serena. Again, Latin. So there's a lot of Latin in this structure and function, which means the foot is foot of the goose.
Go to the goose.
The goose.
That's fine.
So it's something like that. See, can you imagine that? You know, they are very imaginative. So, when, for example, you have trigeminal neuritis, just maybe somebody blows into your face or winds blow in your face, it can trigger very severe pain. That's trigeminal neuritis because it's a sensory nerve, the trigeminal nerve. Or this one, where's number 7? Here, that's the facial nerve.
Shows
Some
Vex.
say Mary Money, but my brother, 7th nerve is also both, but it's mainly motor. There's a very small sensory component, that's why it's considered as both. It is responsible for innervating the muscles of the face. So if it's cut on one side, you'll end up with an asymmetrical face. So when you smile, only this part will smile, the other one will still be frowning, right? Because it's paralyzed. What do you call that condition? Anybody knows? Anybody remember? Yes, it's Bell's. Bell's palsy. You've seen this, right? You've seen people, people with this?
Yes.
No?
What,
Yes.
stroke and stuff?
Well, stroke is different because stroke is not limited to the cranial nerve 7. Bell's is limited to facial nerve paralysis. Usually asymmetrical, usually one-sided. Okay, so when you ask them to frown, the affected
smile.
side will, but the other side remains flat. And the nasolabial fold, this fold, this one will be flat. The affected side will be flat. So it's like one side is paralyzed. Now it's not, clinical significance is not very bad. I mean, they will just recover spontaneously, or sometimes they give steroids for that. So you have to know these nerves because they are linked to a lot of disorders. And they can have a lot of questions too. For example,
The vagus nerve.
trigeminal nerve, there's a question there, trigeminal neuritis, also known as, the other name, okay,
Trigeminal.
also known as tic douloureux. I don't know why.
Touch it.
It's a French term. Tic douloureux is inflammation of the 5th cranial nerve, or trigeminal neuritis. So there's a question there that, I'll just give you the answer that you're not supposed to offer a patient with tic douloureux or trigeminal neuritis with something that's hot or cold drinks, because it could trigger severe pain. Remember, a very small stimulus on one side can trigger that severe pain. So just try to just memorize these cranial nerves. O to touch and feel.
You start. Vince's girlfriends.
No, this is auditory. It is another name here. 8 is also known as auditory nerve.
Yes.
Okay, so O to touch and feel a girl's vagina and
Oh,
hymen.
try good one.
Okay,
How about
and
tiny tops
in
from the
gastro,
Viking?
in digestive system, you've met vagus nerve. Remember?
Yes.
Remember the vasovagal reflex?
Yeah.
Also in cardiovascular, it's mediated by the 10th cranial nerve or vagus. And also, usually the convention is that cranial nerves are numbered in Roman numerals. Have you noticed it? They're always written down as Roman numerals. So be up to date with your Roman numerals. Okay? Because they'll just put it there. Cranial nerve, let's say, what is this?
Watch your superpose.
What's that?
Central nerve.
4, okay? So you have to brush up on your Roman numerals, okay? Because they will just do that, and you know there's nobody to ask. You have to interpret it. In autonomics, you are now I consider you as experts in this already. You know the sympathetic, parasympathetic dance, so to speak. Okay, so
This one.
basically sympathetic and parasympathetic systems. Here, okay, that's what Robert was talking about. In your book, the sympathetics are, I think, orange, and the parasympathetic are green.
They don't believe us.
Okay?
Yeah.
They gonna believe this video.
That's right. Okay? So, parasympathetic is green, and sympathetic is orange. Now, too much to memorize, right? So I will just suggest that you just memorize the sympathetic and just think of the parasympathetic as the exact opposite of the sympathetic responses. For example, here, saliva. Now, start with the pupil. The pupil, sympathetic, will cause dilation, and the parasympathetic will cause constriction, right? What is a sympathetic? Which one again is the fight or flight response?
Sympathetic.
Okay, it's the sympathetic, right? And so just think that everything
Increase.
opposite of the sympathetic responses are the parasympathetic. So all of these here, the orange, the exact opposite is the green. So again, saliva,
Decrease.
okay, the sympathetic will stop secretion, so your mouth will dry up. So when you're fighting, you probably end up with a dry mouth and a dry throat. Parasympathetic, there'll be increased secretion of saliva, and so on and so forth. All right, heartbeat will be increased, blood pressure will be increased. Sympathetic, opposite that, parasympathetic. So autonomic, it's a 2-neuron relay. You already know what that is. And see, it's here, emergency, fight or flight response to the sympathetic nervous system. So basically all the responses there you know already. And the parasympathetic nervous system is the opposite of everything. And what's important is you know the responses, okay? Because you might, the names of the drugs might be based on that. For example, when you say sympathomimetic,
Sympathetic.
Mimics the sympathetic.
so will it be more of a sympathetic response or parasympathetic?
Sympathetic.
Sympathetic, right? It mimics the sympathetic. So and so on and so forth. So there are, and then remember the sympathetic. What is the neurotransmitter here?
epinephrine.
Yeah, it's adrenergic, right? And the parasympathetic is the
Cholehistamine.
cholinergic, which is acetylcholine. Therefore, when you say anticholinergic drug,
Sympathetic.
it will be sympathetic. So when you say anticholinesterase, it will inhibit the inhibitor, so it's parasympathetic.
Yeah. So it's
Right.
cholinergic. That was from earlier.
Do you get it? When you say adrenergic blocking agent, either beta or
Blocks the
alpha
energy.
adrenergic, in general, an adrenergic blocking agent will be
Collagen.
parasympathetic. Remember, your beta blockers will have slow heart rate, right? Slow heart rate, like the olols, atenolol, nebivolol.
Albuterol.
Okay, so that's how you figure it out, because we're going into the drugs within the next few weeks. The drugs that are involved here in the nervous system, there's a lot of them. And it's the same drugs that you've met before in cardiovascular, right? The adrenergic, beta, alpha adrenergic, the antihypertensive
Angiotensin.
drugs, these are the same drugs. Now, we took that for their cardiovascular effects. Here, some of these will be discussed for their neurologic effects. All right? So these are drugs that most of these drugs you already know, or should know,
Familiar.
and have not forgotten. That's the tricky part.
Never forget.
Remember that one?
So we have cholinergic fibers and adrenergic fibers. So acetylcholine is the main neurotransmitter for cholinergic. For adrenergic, it's norepinephrine, also known as noradrenaline. So the fight or flight is sympathetic or adrenergic. Okay, and I already told you earlier, autonomic nervous system regulates the body's automatic functions, not the voluntary. These are the involuntary functions of the body. All right, and that's the last slide. Any questions about the anatomy and physiology? I will try to send it again. And we have. So that you can study. There is a quiz
Any questions or
scheduled
comments?
in the calendar, right?
Smash the like button. Peeps.